Hi, I am Dr. Pramod Garg from All India Institute of Medical Sciences, New Delhi, India. As you all know that acute pancreatitis is a major clinical problem. Infected pancreatic necrosis is an ominous development during the course of the disease. The standard and widely accepted treatment for infected necrosis is considered to be surgery. In the present study, we compared primary conservative strategy with surgery for the treatment of infected pancreatic necrosis. The title of our study is Primary Conservative Treatment Reduces Mortality from Infected Pancreatic Necrosis Compared with Surgery. Acute pancreatitis can either be interstitial or necrotizing, and necrotizing pancreatitis is associated with mortality of up to 40%. Pancreatic necrosis can either be sterile or infected. The treatment for sterile necrosis is medical treatment and mortality is 10 to 20%, but for infected necrosis the standard treatment is surgical and the mortality is higher, up to 40%. If you look at all the guidelines for the treatment of infected necrosis, the standard treatment is considered to be surgical necrosectomy, drainage and lavage. Of late, however, there have been a few case reports which have shown successful outcome with medical therapy. Two studies by Runzi et al. And Lee et al. Of 16 and 31 patients showed 85% survival with conservative treatment. At our center, we have been treating patients with infected necrosis primarily with surgery. We observed that many of these patients with infected necrosis improved with medical treatment, and we changed our management policy since 2003, and patients were primarily managed with conservative treatment and surgery was offered only if medical therapy failed. The objectives of the present study were to compare primary conservative strategy with primary surgery for infected necrosis over a 10-year period, and also to prospectively evaluate the primary conservative strategy for infected necrosis over 2 years from January 2007. We performed a retrospective comparative study, prospectively acquired database, and then prospective observational study. The data were collected from all consecutive patients with acute pancreatitis, and patients with infected necrosis were further divided into two groups. Group 1 1997 to 2002 and group 2 included patients from 2003 to 2006. The treatment protocol for infected necrosis was surgical necrosectomy, drainage and lavage in group 1. In group 2, the management for infected necrosis was primarily medical treatment, including antibiotics, nutritional support, and if required, percutaneous drainage. The primary outcome measure was mortality. In the results, there were a total of 804 patients with acute pancreatitis. 30 patients had infected necrosis in group 1 and 50 patients had infected necrosis in group 2. If you look at the treatment and mortality, in patients with infected necrosis, in group 1, of the 30 patients, 18 were treated surgically. Mortality was 43%. In contrast, of the 50 patients in group 2, 40 were treated medically and the overall mortality was a little lower at 28%. In patients with sterile necrosis, majority of these patients were treated medically both in group 1 and group 2, and mortality was lower in both the groups compared with infected necrosis. This is a representative case of a patient with infected necrosis, and this patient made uneventful recovery. The bar diagram here shows the mortality in group 1 and group 2 in patients with infected necrosis, and you can see the mortality, although statistically not significant, was higher in group 1. When we combine all the 80 patients with infected necrosis over 10 years, we found that those who were treated medically had a much higher survival of 76.9%. This is better seen in this bar diagram, which shows that patients treated medically had a higher survival than those treated surgically. In the prospective evaluation over 2 years, we found that in the infected necrosis group, majority of patients were treated medically, that is 19 out of 27, and the overall mortality was 29%, which was similar to the mortality observed in group 2. Thus, the results of the prospective evaluation confirmed our previous results that primary conservative treatment is effective in patients with infected necrosis. Overall, from January 2003 to December 2008, surgery could be avoided in 59 of 77, that is 76% of patients with infected necrosis. Furthermore, 54.5% of patients could be managed successfully with primary conservative treatment. We are not denouncing the role of surgery in patients with infected necrosis. In fact, some of these patients do require surgery, especially those who have large solid necrotic debris inside. We believe that, like in the case of sterile necrosis, the pendulum will shift from aggressive open surgery to intensive conservative treatment coupled with minimally invasive drainage procedures in patients with infected necrosis. Thank you for watching this video.